Hello, everybody, at yet another again Disruption Talks. I'm Radek Zaleski, senior partner at NetGuru. And those who don't know me, I ask stupid questions to smart people. And today we are welcoming Bjoern von Siemens from a company called Syntax. Bjoern, could you introduce yourself a bit?
Yes, thank you, Radek. So my name is Bjoern von Siemens. I'm a healthcare entrepreneur, and we are creating, with our company called Caresyntax, software solutions for surgery.
Right. So why we're talking today, probably you know it already, right? Everyone in the media, on LinkedIn, on Twitter, is like AI, AI, AI. You know, our jobs will be taken over. Surgeons will lose jobs for sure. Doctors, AI will take over. This is the media hype, right? So we're talking with an expert in the healthcare industry who has this knowledge about AI, who has the knowledge about this exact practice. And hopefully he will be able to tell us what are the industry trends. Should we be worried or should we be excited, and what to watch for in the future? So first question, Bjoern, maybe a bit about you, your personal journey and your background in terms of why you're here, why you are doing healthcare, and why AI. What's the idea behind it?
Yeah, thanks. And I think AI has a lot of promises and a lot of pitfalls. So we'll be interested to explore that with you. I have a background in healthcare because originally I wanted to become a doctor or a surgeon when I was in my youth. And then through different steps, actually found myself more affinity towards healthcare technology and deploying tech to help healthcare providers, so the surgeons, but also the patients, to get to better results. And that's why, together with my partner, Dennis Kogan, I founded Caresyntax over 10 years ago to actually provide software tools and AI tools to surgeons that have been predominantly serviced by medical device companies who are very good at making devices hardware, but who don't typically operate in the software or AI environment.
Mm-hmm. So, our company do software. What I know about software is like move fast, break things. And whenever I hear this about healthcare, I'm like, I'm not sure. So you are a developer, or rather your background is more of a development background, or a coder, or rather business, or maybe you have more of a healthcare education. And what are your thoughts about move fast, break things using software in this industry?
So my background is a mixture of tech, healthcare, and business, and actually psychology as well. Nice. And behavioral psychology, which is important. And I would say in healthcare, move fast, break things rarely works. It's I've seen many companies trying to do something in B2B healthcare, trying to innovate fast and grow fast, and that's usually very difficult to do, almost impossible to do. And there's a lot of reasons for that, a lot of good reasons. Number one is their patient lives at stake. So, if you move fast and break things and you risk patient lives, that is not a good idea. And on the other hand, we're talking about an industry that is, and a sector that is very conservative from a perspective of stakeholders. So we have a lot of, government intervention. We have a lot of regulation around how software can be deployed and how AI can be deployed. And then we have, on the other hand, we have a constituency of users, the surgeons, the hospitals, the healthcare practitioners, that already have a lot to do. So, they are not looking for new things to do during the day. They're looking for reduction of administration tasks. They're looking for really things that help them. And that is really the crux, how to get the software that can help them become more productive, help them spend more time with the patient into their hands. That's a massive challenge that we're just in the beginning.
Right. Why I'm asking, because as a software boy, I am like, yeah, of course, regulations, of course, important, blah blah. But why can we use this AI to improve healthcare of me or my family in near time future? And in software businesses like B2B SaaS or consumer applications, mobile applications, we are used to the cycle of innovation that takes 1 year, right? probably maybe 2 years. What is the cycle of innovation here in healthcare, in software in healthcare? What are the time frames?
It's more not years but decades. So I would say in many spaces in healthcare, we are in 2003 from the perspective of how tech tools, how software tools and AI tools are used. The promise and the potential is very, very large because healthcare is mostly supply-driven problem. So we do not have enough doctors, we do not have enough surgeons, we do not have enough coverage. 6 billion people in the world don't have access to good healthcare. And a lot of that can be and will be solved with better technology. But at the moment, we're kind of in this conundrum of starting to develop the tech, starting to deploy it, getting adopted. And the main issue we see as tech founders or tech software founders and companies is the funding. Who's paying for it, and how do we actually move from this more, we call it in our earlier discussions, the sick care system, to more healthcare centric system.
Right.
And that's, I think, where all the patients like yourselves, you can use software tools and data tools to access more information. And that's the first step that's already happening. So we see a lot of patients coming into therapy already very knowledgeable because they're using ChatGPT or Google to find out more about what they're about to encounter. And that's already very, very helpful.
When you've mentioned that who funds it, you mean who funds it the initial, let's say, scope of work, like an investment? I mean VC or of a governmental grant, or rather you mean who will pay for this as a service as an end consumer or a hospital? Where the problem lies?
It's more on the tail end. So the second part, what you mentioned, who's paying for, improved quality of outcomes? Who's paying for, you having access to information or an app that helps you? Because at the moment, the system is reimbursement based and volume based. So actually, conversely to what would be optimal, it's actually good to do more surgeries or to do more interventions because you make more money. And changing that around to really, thinking about, does that patient really need this therapy? What type of therapy do they need, like personalized medicine? And that would bring us a big step forward.
You got me thinking about this. So here is an application. I just launched it when we were discussing this. His application, funny thing, it's pretty good application developed by the Polish government. It is called your online patient account or something like that. You log into it via main governmental login system, and it's actually pretty useful. Like I was like, no way, governmental organizations can do something useful, especially in healthcare. No way, but it's actually pretty useful because I have access to my prescriptions history and my meetings with doctors, and also there is a as you've mentioned, this preventive type of plan, like take steps, do this type of not application, but meet with this doctor, do this prevention type of treatment. And it's actually pretty useful, but you got me thinking, like, who is paying for it? So right now, I assume the taxpayers are paying for this application and the systems, right? But I'm not paying like an individual. So what would be future might look like? And let's talk about your business, Caresyntax. Does it the future might look like this? That I have access to all my files, history, treatment history, and I can somehow interact with it, read it, take some bites of information out of it, and get recommendations. How it can look like?
Yeah, and I mean, first of all, the app that you just showed is a perfect example of how it can work and how it should work. So most of the money that is flowing into healthcare is our tax money. We're paying for everything. So if you want to deploy that money more, in a targeted way and intelligently, then you want to give the patients, the population, just better tools to manage their own health. And what you have there on your phone is a great way to do that, because you can see your patient history. You can go to different doctors and show them that to them.
Yeah.
You can understand your own health better. And that's kind of the first step. Now moving into, when you are sick, then that is also extremely helpful, because if
Right.
if a surgeon knows your background, your history, or as a surgical team knows it, for us that's extremely valuable information that in 80-90% of the cases we actually don't have. The patient history sits somewhere in disparate data systems, and it's very difficult to get to. So then somebody's doing something that is extremely risky without
And
having
uninformed,
a good
right?
picture.
And uninformed, basically.
It's not uninformed, but there may be data points that are very critical
Okay.
to understand. And the interesting part here is it's also about the environment. So, what is your background? Where do you live? Do you have help at home? All these things play a huge role in terms of the chances of success of any therapy going right, or the patient being happy about the outcome, which ultimately counts, right? So if you have these factors integrated, and if the team that is taking care of you knows them, they can adapt the therapy. But if they don't have the data, there is no chance for them to do that. And that's why we call it data-driven surgery, or data-driven therapy, because you need more information, you need more data, and collecting that and integrating that is something that, in my opinion, is the responsibility of insurance companies, governments, the ones that are funding the system in a way. And it cannot be the hospital as well that is doing that, because they're already stretched thin, they already have so much to do.
Right. So so this topic about informed, educated patient, we touched upon this when we were meeting before this podcast. And you've mentioned, I asked you, what is the next big thing in the industry? And you've mentioned this educated, engaged patient. So I will again talk about myself or my wife. We are very engaged patients, like we Google everything, we question everything, we use ChatGPTs, we get a prescription or a treatment, and we maybe not contest it, not yet, but we try to understand why this happened, and we are trying to talk with our GP doctor, like, you've prepared this type of treatment. Why? What is the reason? Why not this? And my question is it too much, or is it new reality? And is it good or is it bad? And how software will allow me to do this more, or or rather help doctors? Because that's and to finish it, if you read this whole buzz about AI, a lot of people on Twitter, especially in Silicon Valley, they say, "Oh, I won't need a GP. I will just go to ChatGPT and they will tell me what to do and what to take." I think this is maybe a bit too much, right? But I think this is a reality, right? That the patients think they're smarter and more engaged than the doctors, right? So, is it a thing, and how to tackle it?
I mean, I personally think it's very positive what you're doing. I think it's absolutely the right thing. It's statistically proven to give you a better outcome and to help, the system provide a better outcome for you if you're educated about your own health, if you're taking care of gathering information, understanding, what it might be that is bothering you, or what it might be that is a risk for you. So I personally think that is absolutely key. And the systems, you've shown this app. This is something that is not available in a lot of countries or in a lot of places. So it's already, it's quite powerful to have your own record in one place. And for me, having moved from the US to Germany to the UK, getting all the data together. Obviously, I've done it because I'm from the industry, but most people would just sit here and go to a doctor and get and say, do all the tests, do everything, and then as a taxpayer you would pay for it. But maybe it's already available, and maybe it's even available longitudinally. And that is the key. If you want to manage your health, it's not about snapshot in one day. It is about understanding longitudinally, from how is your weight developing to how are your blood parameters developing to all that stuff. And if you have that longitudinally over time, then a doctor will be very quickly able to assess, or even an AI-enabled doctor will be able to assess, okay, those are the risk factors, and that's probably something that we should look into. And then a doctor can come in and really help, manage your expectations and focus on the human to human interaction. And that is, in my opinion, key, because so much of this is psychology, like so much of this is expectation. People that, want to become healthy and that think they can become healthy, they are very likely to become healthy. And that is very much driven by someone, by human to human interaction between a doctor and a patient.
So if I get this correctly, so all those systems and this more educated, engaged patient that is using the data in friendly way is a better partner for the doctor and the system might be cheaper, and doctor having more access to the data can be more human to human instead of giving treatments or prescriptions or tests that are not needed, and you could just take a look at the history. Is it correct? Do I get this right?
Yeah, I think it's it's two things. I mean, one is at the moment, on average, a doctor is spending 50% of their time on administrative tasks, and those might include, trying to gather your files, trying to write a report, trying to do, things that are essentially by now automatable, and that in most other industries you would see they would be automated. But because things are not connected, because the data isn't in one place, there is, a lot of manual data entry still needed, and that takes away time and resources from actually, the patient to doctor interaction, which, as I mentioned beforehand, I see as a critical part of healthcare and taking care of people's health. And, the other part, kind of using AI and using that to prepare a therapy or assist a therapy, that depends on the data as well. So, we have to start kind of thinking about how can we create systems and how can we create longitudinal systems to collect data systematically and make it available for these different use cases, for the patient to become very literate about their own health, and then for the doctors, or for the for the healthcare systems. It might be the nurses, it might be your coach, your personal trainer, whomever, to make data-driven decisions. And that's how people that are very successful in the industry, they do that. So the best surgeons, they record everything. The best sports, if you go to other industries, the best sports people, they also record everything. They want to understand how do I do, how can I improve, my skill sets to be a better golfer or to be a better team player in basketball or whatnot. So it's all about collecting the data, reviewing it, improving on it. And for the patient, it's the same. The more relevant data you have, you don't need to have everything, but the more relevant data points you have, your basic, set of data points, maybe 10, 15, the more literate you can become about identifying, do I really need to go to a doctor or am I just fine? And then you don't need to, spend your own time, spend the system time, spend a lot of money, because you're really in control of your own health.
So Björn, I'm sold. I'm like, yeah, let's do this. This is great. So when, is it like a foreseeable future? And when we will be in this proactive database system, when I, track myself, read the data, and I say, I should do something. If I don't, I will have trouble in like 3 years. When it's going to be a, mainstream reality? It's like 1 year or a decade or 3 decades?
Well, Radek, I mean, you've shown it. I think there's so much already out there. If you use an Apple Watch, I'm not promoting Apple Watches or anything like this, but if you use like some wearable that tracks your steps, if you have your patient history in one place, that's already 80%. That's already 80% of what you can do today. So, and that is already a reality. And if you look 30 years back, absolutely impossible. So already huge step up. And I think, massive impact on society and on behavior of people that use this. Since for example, I stopped drinking alcohol since I use a sleep tracker, because I just see the sleep quality is so poor, it's not worth it. So, these things, they really help make individual decisions that are very good for long-term health. And so I would say that we can talk about very sophisticated algorithms, and that's still futuristic. But there's a lot of tools out there. There's a lot of things you can do today. If you talk about, a real move towards a systematic approach from what we call this kind of additional system to the sick care system, which will still exist and needs to exist because people will get sick, to the healthcare system, that really depends on a regulatory environment and on some people in decision-making positions in the, in the insurance industry, in the payer industry, in the healthcare industry, taking risks. So it's inherently an industry with, where risks are, very rarely taken, but we've been able to gather groups of, decision makers across medical devices, hospitals, and, tech that are willing to move things forward individually. And then there's also governments that are supporting this with money, with changes in regulation, breaking up, the European data space, let's say, like breaking up the silos that exist. So these things are happening. But, for you and me as impatient individuals, it's going to take time, and we're going to see improvements in 1 year, in 5 years, in 10 years, but it's not something that will happen overnight.
I see an impatient individual on a comment section. Przemysław Turkowski, he's my friend from this company, asks, what is the biggest obstacle for wide adoption of such approach? If you could answer, Przemysław.
Yeah, I think it's a good question. It's really, I think it really lies in the funding of these type of solutions and in the incentives. So the financial incentives and the incentives around the system are at the moment geared towards a volume-based system. As I said, it's fee for service. Every time you're sick, you go to a doctor, somebody makes money. And there's this legend, I don't know if it's an urban legend or it's true, but people say, oh, and in the old days in China, the doctors that were the highest paid doctors were the ones in villages which had the healthiest population. So they would kind of measure the longevity, the happiness, the health, and the doctors that would be in that space, taking good care of the people or the healers, they would get more money. So I think, moving towards is obviously not something we can do overnight, but I think really rewarding quality, really rewarding just the collection of data. In the US, there's a bipartisan legislation called MACRA-MIPS, and hospitals or healthcare providers that are providing more data around how was the patient doing, how the intervention went, they get more money per case. Great. So those are the things that can help.
So there's now a question related to this by Przemysław. What do you think? Who should store this data? Is it the government and the public healthcare system, or maybe private companies, or maybe insurance companies? That's a good question. Like where do we keep it? What's your thought on that?
It's an ecosystem. So I don't think that the government can and should build their own systems. I think they need to create a legal space where these things are possible. And, we're talking about very sensitive data. We're talking about patient-related data. We're also talking about data that contains risk in capturing it because people are afraid, hospitals are afraid to make mistakes. So you can create what is called in the US, for example, patient safety organization. And people can donate their data, or organizations, hospitals. And if you do that, that data is protected from being used against you. So it's only to your benefit. You donate the data, you get some analytics back. So these kind of spaces are important, legal spaces that are protected to collect the data. And then I think from a regulatory perspective and from a financing perspective, incentivizing, as I mentioned, quality, talking about, the data collection as some element of reimbursement, really paying more for the doctors, for the hospitals that are collecting the data, is a step that has been taken, and it's proven to be very, very effective.
Cool. Thanks.
I hope that answers the question.
If not, they will back to it or touch upon later. I want to move to the most important topic that we agreed before this conversation today. that is again me. So when I was a kid, a teen, I was playing basketball and I basically destroyed my knee. And I had a procedure, like a surgical procedure. And since then, I can kind of do some sports, but playing football or basketball brings me a pain. And I can, run or lift weights, but I'm not the same individual that I was. And your company, how I understand, is responsible for making sure that you observe and take data of over 500 million surgeries every year, if I remember correctly, right? And if you could walk me through how it would be different with my knee injury with such a system as Caresyntax right now to what happened in before, and what would be the, maybe the preparation, the process, the outcomes, and how would be how it change my life, maybe, for the better.
Yeah, absolutely. And I'm sorry to hear about the incident and that it's still impacting you. And we have collected around 10 million data points from surgeries, or 10 million cases. 500 million is actually the total volume of surgeries per year. So surgery overall, surgery overall is a huge success story. It's a big part of modern medicine. 100 years we had maybe 5 million. Now we have 500 million surgeries globally.
So I got it wrong, right? So 500 million surgeries globally, worldwide, and you take cover about 10 million a year. Do I correct?
It's 3 million a year to 10 million in total, because we've been in business for a certain time. So about 3 million surgeries are touched by our data and technology. And what we really changed is essentially what we spoke about before. So when you had your injury, back then systems didn't exist. So very likely you came into a hospital, somebody looked at you and said, okay, we need to do a surgery here. And then somebody else would do the surgery. Maybe you spoke to the surgeon once, maybe they knew a little bit about your case, and then they would operate on you. And then afterwards you would be discharged and somebody else would be taking care of you.
This is what happened. Yep.
So that's the process. And that process is prone to a lot of variability, a lot of errors, just because we're all humans and because the data isn't available around, what is specifically the right therapy, the right device, and the right setting for you. And what we do that is different is we make sure that before you go into surgery, we collect, dozens of data points about you. Obviously, the medical history, what has happened exactly, how is the fracture looking and so on the medical side, but also the environmental factors. Because if after the surgery you have very good rehab and you have a very good support system around you, the likelihood of full recovery increases exponentially. So we're making sure that we capture these pre-operative factors and that the surgeon and the surgical team exactly knows what is your background and can do, the optimal intervention for you. And then basically afterwards, you get a much better care because you have an app. Obviously, you have a connectivity directly to the surgeon. Surgeon can do what's happening to your functional development and so on.
This app is something Caresyntax provide. Do I get this correctly, or a hospital that is using your systems?
Yeah, we can provide it to the hospital white label. It doesn't, it's not always our app that collects the data, but we collect all the longitudinal data, and we are kind of the quality assurance system, if you wish. So we make sure you're not going into the surgery before all the data is captured. The appointment doesn't happen. So even if we have to call, if somebody has to call you or your GP to find out everything, we'll make sure it happens. And then you have that data, and then the team can take care of you. And that's very important during the surgery, but it's even more important after the surgery. Because let's just take a hypothetical example. Let's say you're 70-year-old and you have that knee injury. Let's say you're living by yourself. Let's say, you were depressive beforehand. Those things are high predictors of non-adherence to post-surgical rehabilitation. And that means we need to be more engaged with the patients that need the engagement. We need to send someone, we need to make sure that you're doing your exercise and so on. Whereas with a young patient, maybe it's enough to inform your parents about it, and maybe it's enough to regularly check in. So we can adjust the level of care to your needs and make sure that we spend more on the patients that actually need more care and spend less on the patients, including doing, if you're young, you don't need to go to the university hospital because it can be done outpatient. It can be done very quick because, your organs, your systems, your knees, everything is still, recovers very quickly. So it's much better for you if you go in and go out same day, next day, the mobility starts, instead of you going and lying in a bed for a week, which is good for somebody that is 80 years old. So we tailor the surgery to you. It's personalized precision medicine, and that increases dramatically, by 2, 3, 4x the chances of a full recovery or near full recovery vis-a-vis a standard process.
And this is value for me, which I get as a patient, and for the overall system, I assume the value is that the care and the treatment is more efficient, right? Because I'm not being sent to this, the best hospital or the hospital with all the potentially required equipment for maybe older person, but I'm sent to maybe other institution, right? Or if I'm an older person, someone makes sure that that there is this after surgery care, exercises or whatnot, right? So it makes the system also work better. So it's not only for me as an individual, but for the whole healthcare system. Do I get this correct?
Correct. So it's for you as a patient, it's, it dramatically reduces the risk of complications, of inefficiencies. For the systems, it's better because if you have a complication, usually people need to be reoperated or something needs to happen to make sure they are essentially, getting better. You may be less productive even. Let's say, you would have a job that requires mobility. You wouldn't be able to do that job, right? So you lose a lot of productivity, a lot of cost, let alone the pain for the patient. And then for the system, it's much, much cheaper if you tailor it, because you're going to go to the provider that's best for you. And, the surgical centers, they don't provide less quality of care. They actually have a, better quality for you, but they're much less costly because you don't have intensive care. You don't have everything else around. It's just an in and out. So that is the value for the system. You reduce the cost. The patient is in a better, in a much better care pathway, as we call it, than if it's just a one size fits all approach.
So I will go back to my initial question about this engaged, or put it more bluntly, picky patient. So if I have access to all the data, all the systems, and all the precise treatment, as you've mentioned, can I question it? Like, can I ask difficult questions? Like, I get, Bjoern, that the system tells me to go to this hospital, but I want to be in the university hospital. I need this. Is it a risk maybe that people are going to question the ideas done by the robots, by the evil AI, or is it non-issue?
I think we should question everything. I mean, I think if it's about your health, if you have a question, you should be allowed to ask it. Whether or not you're the decision maker, that is a different question, because at the end of the day, the decision maker should still be the doctor and the specialist in the area. So I don't think it would be a great idea for a patient to be able to say, I want this surgery or I want that, without a doctor approving it or a doctor recommending and approving it. So I think you should be able to, and you should ask all the questions you have. You should Google everything you can, and then discuss with your doctor and your caretaker. And that's why it's so important to have this human to human time, so that you can clarify your concerns and your questions. The doctor learns everything that they need about you and can make the best decision. So by all means, ask all your questions, but you shouldn't make the ultimate decision whether or not you need a surgery, because that may be not a good idea for you.
I will pass this information to my wife and tell her to be very assertive with with our healthcare system. There are some questions in the comments. So the first question from LinkedIn is lost in the comment sections. Write Anita to me, and the question is by Subhashri Saha, if I read it correctly. What is the worst thing do you think someone can use this data against the ecosystem? So I guess it's a question about how malicious actor can use it against us.
Yeah, there's a risk. There's a significant risk if this data is used against you, because it contains a lot of private and personal information, and that's why data privacy and creating these safe spaces, both from a regulatory and technology perspective, is so important. And I do believe that every region and every in a way country or group of countries like the EU or the US or China, they will all have their own cloud of healthcare data. They will not outsource it somewhere else just because you want to be in control of that data, because it could be used against you if it goes into the hand of private companies or bad actors or something like this. But I do think that the value you get from sharing the data and putting the data is so much higher than the risk, because at the end of the day, what could happen? Somebody, obviously, if an employer gets your data, they could say, oh, they don't hire you, or someone could try to market something to you that you don't need or that is not great for you. There's also all kinds of different scenarios, but I think the value of collecting the data, if it's in a safe space, is exponentially higher than the risk, because at the end of the day, what I observe, in most cases, actually people have good intentions and most people want to do good in most positions. There's very few that, have more their own intentions, and there's very, very few that really have bad intentions, but most people have good intentions. And I think, we obviously need to create these safe spaces from a perspective of tech and regulation. But I would say that, what you've shown today, even with this app, right, that's already a step into the right direction. If the Polish government didn't decide to do that, you wouldn't have that. Is there a risk? There is a risk. If your data goes somewhere else, somebody else has it. But why would they? The question is for me, like, why would they use it against you?
Right. So I think you can. I think what maybe I'm not a healthcare expert, but I'm a software expert. So what I can think is that if you get a lot of this data and use it as an aggregate, that can be a vector of attack against, I think, institutions, not individuals, but I think maybe against institutions. I assume that some bad things might happen if someone wants to do something with insurance issues and insurance companies, maybe to on that angle, probably. But yeah, I think I think individuals are more safe than institutions in that aspect. I mean, our healthcare data is already somewhere in some hospitals, but in a paper format. I don't think it's managed well. So I don't think it's
definitely less safe if it's flying around on a USB stick than when it's in a safe cloud. Correct. So you know that as an expert, that what's happening at the moment is, because of these siloed data, people are using, doctors are using their personal phones, people are communicating over unsecured channels. So at the moment, the risk is much higher because we don't have a systematic approach to it. But of course there is a risk, and I think it's like with everything that has to do with AI. I spoke with Sam Altman the other day because they're so interested in this healthcare space, and I asked him, what do you think is the risk of AI becoming globally a malicious entity? And he said, we need to work on it. We need to be on it. We need to be vigilant. We need to work on it every day. We need to make sure that the risk mitigations are in place, that the government and the institutions are putting risk mitigation in place. But overall, if we do that and if we manage it, then we're going to be okay. If we don't, if we just think, oh, it's going to take care of itself, then it's not going to work.
I agree 100%. And with that, let's wrap it up. We had a really lovely 40-minute conversation. To the audience watching live and later podcast and whenever you're going to watch or listen, if you have questions to Bjoern, I think he will answer. He looks like he loves to answer those questions, and I think he's really, really, really good at understanding this. me personally, I'm excited about this future and how it can improve, especially life of my kids in the future. And again, I will go back to this Polish system that I think it would be great to see in other developed countries. So I have 2 kids under my name in this system, and I can see basically from the very first day of when they were born, all the treatments and prescription history, and whenever they attended a doctor, who was the doctor. So, that's a marvel, right? I can see that 3 years ago we visited this person and in this place and call there and ask for data, right? And maybe in the future, this data will be in those systems, and it will be a help to have a predictive healthcare system, as Bjoern explained to us, which I think is a better system than reactive system that we have right now. Bjoern, thank you very much. And it was lovely to chat with you, and good luck with your endeavors. Thank you.
Thank you, Radek. It was a pleasure.
Bye.
Take care.